Hi, my name is Alex Shoyam. I'm a pediatrician with a background in genetic diseases involving inflammation, and I'm Senior Vice President of Rare Disease Development at Aceragen, which is a biopharmaceutical company focused on developing potential therapies for patients with high unmet medical needs, and through this, hopefully helping patients and families to live the fullest possible lives. I'd like to talk to you today about a cause of hard-to-treat polyarticular arthritis, which may be misdiagnosed as juvenile idiopathic arthritis or seronegative rheumatoid arthritis. This is Farber disease. The differentiating symptoms that may help diagnose Farber disease in the case of a patient with polyarticular arthritis would be subcutaneous nodules, a hoarse or weak voice, osteolysis, or pronounced muscle weakness. It's important to note that subcutaneous nodules are typical of Farber disease, although like these other symptoms, they may vary in severity from patient to patient, and also in comparison to the other symptoms that are present as part of the disease. Histopathology reports may come back as nonspecific granulomas or rheumatoid nodules, so histopathology is not necessarily a definitive evaluation in these cases. Biologics may also confound the diagnosis, as inflammation and pain may be reduced with the use of biologics like interleukin-6 receptor blockers, but the overall progression of the disease will not be stopped, as this is a genetic condition and the biologics serve only as symptomatic therapies. Farber disease is caused by mutations in both alleles of the ASAH1 gene, leading to a deficiency of the acid-ceramidase enzyme, the buildup of a sphingolipid called ceramide, which is pro-inflammatory and pro-apoptotic, and that drives a macrophage inflammatory process, which is underlying most of the symptoms that we see in Farber disease. The phenotypic spectrum is broad, with some patients dying in infancy or in early childhood because of a rapidly progressive disease course. Other patients with a more moderately progressive disease course generally misdiagnosed as having juvenile idiopathic arthritis, as their symptoms may take years to appear together. The same is true of more slowly progressive disease, where patients may only be diagnosed in adulthood once their long-standing symptoms create problems that are unavoidable from the point of view of their day-to-day lives and require an expanded diagnostic testing regimen. Farber disease has been diagnosed all over the world. Again, patients who have quote-unquote typical symptoms and rapidly progressive disease would be likely to receive genetic testing earlier, although they may also be diagnosed with an inflammatory condition other than Farber disease initially. And other patients with more moderately or slowly progressive disease carry a misdiagnosis of juvenile idiopathic arthritis or seronegative rheumatoid arthritis in most cases until they're diagnosed through genetic testing because of the lack of response to therapy or the development of other symptoms. For example, in the literature recently there have been several cases published of patients who were diagnosed because of peripheral osteolysis developing in adulthood. Genetic testing is available at no cost through Aceragen. The genetic testing samples are either saliva samples or a dried blood spot. This test is performed at an independent testing center, and the reports are directly sent back to the physician. Aceragen receives no information about patients or testing results. So I hope that I've shown you that Farber disease may underlie the symptoms which can be misdiagnosed as juvenile idiopathic arthritis or seronegative rheumatoid arthritis. As you can see in the pictures in the middle and the right side of the screen, it may be difficult to find those subcutaneous nodules or symptoms that would indicate the need for genetic testing in a patient unless one has a very high degree of suspicion. I think that with symptoms such as subcutaneous nodules, osteolysis, a hoarse or a weak voice, or pronounced muscle weakness, in combination with juvenile idiopathic arthritis or early onset rheumatoid arthritis, genetic testing for ASAH1 mutations is certainly very reasonable, and as I mentioned before, can be done relatively simply and quickly. Thanks for your attention, and I'd encourage you to visit our website where you can learn more about our company and our efforts to help patients and families live the fullest possible lives. Thank you very much.